Hi everyone. Thank you so much for tuning in to this week's episode of Shannon Sunshine Share. I'm Shannon Reglis with the Lantern of Madison, and today we're going to talk a little bit about urinary tract infections or UTIs. We see frequent instances of urinary tract infections in the elderly population. So I just wanted to take a little bit of time and talk about just a general overview of urinary tract infections. What are they? How can we prevent them? How are they treated? And things along that line. So I hope that you find today's episode informative and get some of your questions answered. So I thought we should start off with talking a little bit about the anatomy of the human urinary system. So we have 4 parts. We have our kidneys. That is where urine is made. We have our ureters, and that is the tiny little tube that carries urine from the kidneys to the bladder. Of course, we have our bladder, and that is where urine is stored until we release it by urinating. And we have our urethra, which is the tube that carries the urine from the bladder to the outside of the body. So when you're talking about a urinary tract infection, the infection can be occurring in any one of those places in the urinary system. And so like I said, we see a high amount of urinary tract infections in the elderly. Why is that? Some of the most common causes of urinary tract infections would be urinary incontinence. So why would we get an infection if we're incontinent of urine? So some of the reasons might be that you're leaking urine, you're wearing adult underwear or pads, and you're not changing them frequently enough. Or when you do change them, you're not cleaning and washing your peri area and making sure it's dry. So that can definitely lead to a urinary tract infection. Urinary retention is when you can't completely empty your bladder. And some of the reasons this might happen, especially in the elderly, is because our bladder muscles weaken and become less flexible as we age. In men, sometimes enlarged prostates can kind of block off the urine from flowing smoothly as it should. Prolapsed bladders in women can sometimes lead to difficulty emptying the bladder, causing a little bit of retention there. And then kidney stones are blocking the tubes sometimes and can block the flow of urine. So those are some of the reasons. Hormonal changes. So younger women especially have a lot more estrogen than the elderly population, and estrogen helps protect the balance of bacteria in the bladder and the urinary tracts. But of course we know that the level of estrogen declines as we age. So when you have a drop in estrogen levels, the linings of the urethra, the bladder, all of those can become thinner, leading to possibility of a urinary tract infection. Believe it or not, obesity can be a leading cause of urinary tract infections. People with a high BMI or body mass index are more likely to have a urinary tract infection. So it can definitely put you at greater risk. So what are some of the things that we see in the elderly, a population in particular, when we're thinking someone might have a urinary tract infection? So some of those things that we see, let me start off by saying, anytime you see a sudden onset of change in behavior or symptoms you haven't seen before in yourself or your loved one, definitely call your physician right away. A lot of times they will start with a urine test and maybe some blood work to see if maybe there's some kind of infection going on. Like I said, especially when you have a sudden onset of some of these symptoms I'm going to mention. So confusion, agitation, hallucinations. Your loved one or yourself, you might be seeing things that aren't really there. You might feel restless or fatigued. You're less alert than normal. Maybe you're having some sudden unexplained incontinence episodes. You know, you're having some leakage from your bladder and you really have never had that before. Increased falls, especially in the elderly, and other declines in physical functioning. Like I said, the weakness is a big one. Some of the physical symptoms that you might have are frequent urination. So either urinating a lot or having the urge to go a lot, or both. Burning when you're urinating, those can all be signs of a urinary tract infection. So please make sure that you reach out to your physician just to let them know what's going on. So untreated urinary tract infections can be very serious if untreated, even fatal. Sometimes the infection can travel to your bloodstream, causing a septic infection. And that is definitely not a good way to, you definitely don't want to let your symptoms go so bad that you're getting an infection that can be fatal. So that's why it's so important to keep track of what your body's telling you and reach out to your healthcare team and let them know what's going on with you. Septic infections, some of the signs of that would be a fever, a high fever, increased heartbeat, more confusion. And if you go into septic shock, your blood pressure drops to a dangerously low level. You have an altered mental state, and septic infections can lead to eventual organ failure. So, this is important, guys. Definitely make sure you're keeping on track of things that are going on with your body. Treatment of urinary tract infections. When we think UTI, we think antibiotics. So oftentimes physicians will prescribe antibiotics for a urinary tract infection. Your doctor may dip your urine to kind of look for signs that there's something going on. There might be something growing in your urine. And if that shows positive, they will send what's called a urinalysis and a culture and sensitivity to the lab. So they'll have you urinate in a cup. They'll send your urine out to the lab. What they're looking for is there a bacteria growing in your urine? What bacteria is it? And what antibiotic, with the culture and sensitivity, what antibiotic will kill that specific bacteria that's growing? So if your doctor does prescribe an antibiotic for you, please, please, please always make sure that you take the entire course of antibiotics. I know we've all heard this since we were kids. You got to finish the whole prescription, even if you're feeling better, because if you don't, your symptoms definitely could return. Just because you're feeling better, you say, oh, I don't need this antibiotic anymore. Your symptoms can definitely return with a vengeance. So you want to make sure you're completing the entire course of your antibiotic. So like I said, let's just review a little bit. You're feeling an overwhelming need to urinate immediately, even though you just went to the bathroom. You have a burning sensation when you urinate. You're urinating a lot more frequently than normal. You can even have pain in the pelvic region. You can have pain in your sides. That could be maybe a sign that there's something going on in your kidneys. So, right along the back here, your sides. But again, a lot of these symptoms can be seen in seniors in our elderly population who don't have a UTI. Sometimes these symptoms are part of aging. And so you just really have to be on guard and be alert. Make sure that you're keeping in touch with your medical team, letting them know, again, the symptoms that you're having. It doesn't hurt to just get your urine checked out just to make sure. Because, again, you don't want to develop an infection that would cause sepsis, because that is very, very dangerous. And then, for folks that might not be able to voice, The symptoms that we're having, again, we're looking at sudden onsets of increased confusion, restlessness, agitation, hallucination, those types of things. And a lot of times, like I said, the first thing the doc's going to check is the urine, and possibly some blood work. Some folks are kind of just cursed with recurring UTIs. If you have a UTI more than twice in a 6-month period, you are diagnosed with recurring UTIs. So recurring UTI is a reinfection or the same infection reappearing because it wasn't completely cured. Another reason, again, finish those courses of antibiotics that your physician prescribes you. Again, I've seen sometimes that physicians don't use don't use an antibiotic. One thing to really remember when you have a urinary tract infection is you really want to push fluids. Definitely drink a lot of fluids. We should always be drinking lots and lots of water, but especially when you have a UTI, you're going to want to avoid things like spicy foods, because it's going to make it a lot more painful when you're urinating and you're already having some issues. So you don't want to do that. Sodas, wine, and alcohol. And unfortunately, guys, I'm going to say it, coffee can irritate your bladder. So sometimes when you're recovering from a urinary tract infection, you may want to switch your coffee over to green tea, because there are scientific studies that have shown that green tea is helpful while you're recovering for a UTI. But you definitely want to avoid those things that will kind of wreak havoc on your urinary system while you are trying to recover from your urinary tract infection. So some tips that I can give you for urinary tract infection prevention would be, don't fight the urge to go to the bathroom. If you gotta go, you've gotta go, head to the bathroom. It is not healthy for your bladder to hold urine for long periods of time. During the day, you should be going at least every 3 to 4 hours. Stay hydrated. 8 to 10 glasses of water a day will help keep that bacteria at bay. Your urine should be clear and light colored. There should not be a strong odor. So make sure that you're paying attention to that. A lot of times people who have incontinence or urinary urgency related issues tend to decrease their fluid intake, thinking that, oh, well, if I don't drink a lot, I won't have to go a lot. This definitely will not help your bladder in the long run. Practice good bathroom routines. So obviously, keeping your perineal area clean and dry at all times. So if you are using pads or adult type briefs or underwear, make sure that you're keeping them clean and dry. Make sure that you're washing really, really good whenever you're changing those, whenever you go to the bathroom, and make sure your area is kept nice and dry. Let your skin breathe. Wear cotton underwear if you can. Avoid tight-fitting pants. Make sure that things are breathable and comfortable. Frequent showers. A lot of times they say that, women especially can get recurring UTIs from taking a bath instead of taking a shower. Don't use deodorant or sprays near your peri area. Women, elderly women might talk to their doctor about the loss in estrogen that's occurring in their body. Definitely you can talk with your doctor about that. And double voiding. So that's kind of a fun word. What does it mean? It means urinating twice during one visit to the bathroom. It can help prevent urinary retention. So when you've gone to the bathroom and you think you're done, try to go again. See if you're able to empty your bladder. One thing that we see a lot too, and I just want to take a little minute to just talk about this, is catheter acquired infections. So we try our best not to place urinary catheters in patients unless we absolutely have to. A lot of times we have to do it because, they're retaining urine, they're not able to go. It's definitely not healthy for them to be holding that urine. Sometimes you'll see folks that have to get straight cath, which is like being catheterized several times a day, or sometimes you'll see folks who have an indwelling catheter. So if you or your loved one has a catheter, make sure that you understand how to clean and maintain the catheter, just to make sure, that you're not pulling on it, kinking it, twisting it. Make sure the drainage bag is always, always, always below the bladder, because you don't want that urine that's already been excreted from your body going back into the tube and back into your body. That will cause a whole mess. You definitely don't want to go there. So please, please make sure. If your loved one is incontinent, put them on a toileting schedule every 2 to 3 hours for sure. Make sure you're assisting them to the restroom, making sure they're nice and clean and dry, and that will help a lot to avoid the possibility of getting a urinary tract infection. And I don't know. I think we talked about a lot. I think, just a brief overview. Sometimes if you're seeing just kind of odd things out of nowhere, again, make sure you call your doc, check in, say, hey, this is what I'm seeing. It might be just as simple as checking a urine. Doctors always want to start with the less invasive thing first. So that is just a little bit of an overview on urinary tract infections. I really hope that you learned something from today's episode, and I thank you so much for tuning in, and I hope to see you again soon. Have a great day.